Western Mass News is your vaccine authority. Massachusetts now allowing caregivers who bring seniors to the state-run vaccination sites to also get the shot against COVID-19. Thanks for joining us, everyone, on this Thursday. I'm Chris Pisano.
And I'm Jordan Jagalinzer. This differs from Connecticut and has raised some questions about how the two states are running their own separate rollout programs. Western Mass News reporter Audrey Russo joins us live in Springfield with more. Audrey?
Well, the two states are very close together, but if you step over the line, different people are actually eligible to get the COVID-19 vaccine. We've gotten many calls into our vaccine authority hotline, and tonight we're getting answers.
There's a clear difference, first and foremost about who is eligible just to receive vaccines at different time points throughout this rollout.
Dr. Robert Roos is the chief medical officer at Mercy Medical Center in Springfield. That hospital is part of Trinity Health New England, which also operates in Connecticut. So Roos has gotten to see firsthand the differences between the COVID-19 vaccine rollout from the Bay State to the Nutmeg State. Right now, Massachusetts is currently vaccinating those 75 and older, and now caregivers of those seniors. Connecticut is taking a different approach, moving right on to those 65 and older, but not allowing the same caregiver rule. Differences, Roos says, were allowed by the federal government.
They left up the decisions regarding eligibility and the timing of when people can get vaccines up to the individual states.
Roos tells Western Mass News the strategy differences don't just end at who can get the vaccine, but also who can give it out.
Connecticut early on seemed to allocate a lot of vaccine to hospitals and healthcare institutions to build up capacity very quickly.
In Massachusetts, he says,
the allocations out to hospitals seem to be quite a bit less, particularly here in the western part of the state.
He believes Connecticut's rollout has been quicker paced, but says Massachusetts's large-scale vaccine sites will help the Bay State catch up.
We've seen improvement going from one of the states that's been near the lower tier, now bringing it up much more towards the median when you look across the country.
Now, unlike Connecticut, Massachusetts has not started vaccinating those who are 65 to 74. They are in the next rollout group along with those with 2 or more serious health conditions. State officials, however, have not said when that will be. Live in Springfield, Audrey Russo for Western Mass News.